we were probably all a little naive, thinking that banks are going to do the right thing and raise the flag and come to the aid of small businesses and major businesses of America. No, they took care of themselves. So, sad to say, but they made a lot of money. I know some banks took that money and invested in the stock market because the stock market was down, and they rode the tide of recovery with the stock market. So they made, you'll see some of these banks having record profits now from the bailout money, but the loans aren't there.
Yes, which means that then the impact on small businesses has been great during this recession.
Well, the good thing about an entrepreneur, you learn how to deal with adversity. There are a lot of struggles. So our members are hanging in there. They weren't expecting the bank. They know the nature of banks. They pooled their resources. They gathered up. They downsized and cut growth and went into survival mode. So we haven't lost that many small businesses as major businesses are falling. But most of our business, in fact, our membership has grown. Since the recession started, was admitted to.
Well, how are small businesses dealing with the health care issue?
We're hoping and praying that Congress will deliver a health care reform, to where we can maintain our good employees and also offer our employees a good quality of life by good health care. A sick employee is an employee who doesn't come to work. An employee who has a child with cancer, or a wife or husband with cancer, is an employee that's not going to perform too well. So you want everyone happy and healthy, and that makes a robust economy and a safer America.
Now, health care coverage is very expensive. Are there a substantial number of small businesses that can offer healthcare coverage for their employees?
No, it's elusive, and we've worked with some insurance companies, and we're continuously working with some of the major insurance companies to offer plans, and the brokers and such, they come through, but some do, some don't, but usually a company that offers insurance is a company probably doing in excess of $10 million. They can afford that, but a company that's trying to get to that first $1 million in annual sales with a few employees usually will delay the opportunity to buy insurance because they can't afford it.
Now, in some chambers, major chambers, the membership has the ability to purchase the insurance as a group through the chamber. Has that opportunity been offered to the National Black Chamber?
It's been studied, but no, it has never come to fruition. Some of our chambers, the Greater Los Angeles African American Chamber of Commerce, which has over 1,000 members, and others, they haven't been able to do that either.
So this is really kind of reserved for the little bit more than small business people.
Yes, ma'am. I'm on the board of the U.S. Chamber of Commerce, and that federation, locally based chambers usually cannot offer that either. The traditional chambers.
Yes.
It's something that America has needs to concentrate on, and it's a loophole in our system that needs to be filled.
And small businesses are somewhat at a disadvantage than the large corporations. What are some of those disadvantages?
Well, lending power for one, economy of scale, being able to buy supplies at a reasonable price. It's hard to be a grocery store when you're competing with Kroger and Safeway. You can offer friendly service and what have you, but what's on those shelves is going to cost you a lot more than it costs Kroger or Safeway. You've got to find your niche. And I think one of the fastest growing industries is IT, because the field is level there. I think legal services, the field is level there. If you have a law degree, you're a lawyer. And you could have 2,000 lawyers or 20 lawyers. Doesn't matter. You can still be a good lawyer and a good law firm. So I think goes into construction, which will always be here. We're always building up or tearing down and rebuilding. That's a big industry also, and that's really growing. In the private sector, we need to improve it in the public sector. I think the construction unions have had a lock on that, and we're trying to chip away at that.
Oh, I see what you're saying. So small businesses have a lot of different obstacles than larger businesses. First, I guess the number of people that they hire.
Yes.
And secondly, it's too expensive most of the time for their employees to get insurance independently of the company. So if the company attempts to purchase, their negotiating power is much more limited because they have fewer people to negotiate for. So what percentage do you think the small businesses, what percentage do they offer insurance? Do you know that?
15-20% would be my educated guess. We have young staff, and it's easier for them to get their own individual insurance because they're 23, 24. But if they come into us, the senior citizens, and get into that pool, it just jumps way up. So it's easier for them to get their own insurance at this early age.
Yes.
But when they reach 30 or 35, then it becomes the big issue.
When you need it.
When you need it the most, right. The chances are they're not going to need it. So it's Christmas time for the insurance companies, those premiums.
Well, the insurance companies really have enjoyed a great run at the expense of the policyholders.
They have a lobby. I studied Title VI of the Civil Rights Act. I'm quite a student of that. Do you know the insurance industry is exempt from Title VI of the Civil Rights Act? That's how strong their lobby was during those times.
Well, they spent millions and millions of trying to give out misconceptions on what we're attempting to do here, and it's really unfortunate because what they're frightening people, and most of what they're saying is really exaggerated and untrue. But we have the First Amendment right, so they have a right to say what they want to say. But it's really unfortunate for the bulk of the people of this nation, because that means that it cuts off the opportunity for people to get insurance. But it's been well known and well documented that insurance companies like to insure young, healthy people. When they get to the age where they're going to need some type of health care from either chronic illness or something, they get dumped over into Medicare first after they paid all those years and didn't use it. And that then puts less burden on the insurance company. But the medications and the co-payment, the seniors don't have anyone who is in a position to negotiate, because the bill that was passed, I think that was 2006 or something, prohibits the Health and Human Services from negotiating on behalf of seniors, and which I thought was a really unfortunate move for our senior citizens. So we're kind of boxed in with what the insurance companies are doing to the people of this nation right now. And that's one of the things that we really do need to address: the pre-existing conditions, the dropping people from insurance once they get certain diagnoses, the cost that goes up sometimes without warning. It is a very difficult thing for American people to get insurance, and it is the hardest, as you mentioned earlier, in the world. And yet we have the best research. We have, at the taxpayers' expenses, we have learned many breakthroughs. Our space exploration research has delivered us many, many breakthroughs. And that has been at the expense of all taxpayers. But our taxpayers often don't have enough money to get insurance, to have access to what they've paid to be discovered.
Our Caribbean members, many people who are from the Caribbean, through the British Commonwealth, can get a passport, citizenship to Canada. They get that citizenship to Canada for insurance purposes. We had a guy working in our office. He's from Barbados, but he had a Canadian citizenship, and he had a heart condition, which was going to kill him financially. He moved back to Toronto and got free medical care for his heart condition. He's doing fine now, but he'll never give up that Canadian citizenship just because of their health care system.